What is there about laughing that just makes us feel better? And is it more than just feeling better? Does it really affect our health? It is a thoughtful look at laughter. The doctors are on call tonight.
I love to laugh.
Funding for On Call is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
LARSON Manufacturing is proud to support On Call, starting its 11th year of opening doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, Regional Health, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
Hello and welcome to On Call Television. Tonight is a show about laughter. Who said laughter is good for the soul? The Bible quotes King Solomon in Proverbs 17, stating, "A cheerful heart is good medicine, but a crushed spirit dries up the bones." Scientists have shown that smiling dilates blood vessels, increases blood flow in a way similar to that of aerobic exercise, and laughter in many ways prevents heart disease. And there's a lot written about humor helping people deal with cancer and many other complicated medical conditions. If you just think about Norman Cousins and Bernie Siegel selling books, but it's more than that. There's good science behind this trend. To help us understand how we have what we have here in South Dakota and to learn about laughter is Dr. Carrie Horwitch from Seattle, Washington, an internist. She's a generalist who has training in tropical medicine, HIV medicine, preventive care, biomedical ethics, public health, and emerging infections.
Wow.
And also with us is Dr. Alan Forker of Kansas City, Missouri. He trained at the Mayo, was on the faculty of the University of Nebraska, now practices cardiology internal medicine in Missouri. Both are governors of the American College of Physicians. Welcome.
Thank you.
Carrie, would you tell us a little bit about this laughter therapy thing that you've gotten into and maybe why I dragged you all the way out from Washington to South Dakota?
So part of the way that I got involved was I actually had a serious illness, and one of the things I attended was what was called a laughter club. And I thought, what an amazing experience. And I was a little skeptical, being a physician, saying how much fun could this really be? And I actually participated in this group, and it's laughing for an hour, and I said, this is golden. And then, of course, since I am an internist and since we all believe in evidence-based medicine, I actually had to go to the literature and say there's got to be some science behind this. It can't be just because it feels good. That's not good enough.
No.
And so then I went to the literature, and I found a lot of articles, which we could talk about if we want to, that actually showed a lot of the health benefits for laughter. And actually even more surprising was how little adults laugh. And there's a lot of surveys out there that show that. Now, how the audience might know, how many minutes a day do you think adults laugh on surveys? What do you think?
Less than a minute.
Less than a minute, okay. Well, you guys are much worse than the survey then. It's about 6 minutes for adults. And what about children? How many minutes a day do you think children laugh? Right, 400 to 500. So you wonder why. Now you could say, well, they're carefree because they're kids and we have to have all the worries.
Yeah.
But there is something that we lose for some reason as we get older, and part of that is being silly and laughing. And there actually is a lot of health benefits to bringing that back into our lives. I started doing this teaching more so to teach physicians and healthcare professionals to actually have a way to release some of their stress. We have very busy jobs, we love what we do, but we do deal with people who have serious illnesses, and we need ways to make sure that we care for ourselves. And so I really think this is something that we can use for ourselves. And I've then now started to use it with my patients as well, but first I did it for me and my colleagues. So
Yes.
that's how I got started.
So now, why in the world, Alan, a cardiologist from Kansas, would you come up to join us?
Well, that was a slip of the tongue. You didn't know that I'm actually a native Kansan, but I work in Missouri, and I'm the
Oh, you're right, a slip of the tongue, you're right.
But for those of you who know Kansas City, there's a state line in the middle. This is Kansas and this is Missouri, so I can be either side. Yeah.
Yes.
Well, I'll tell you, it's a very personal story, and that is when I arrived for internship at the University of Minnesota. There were 12 of us, and 6 were from Harvard. There was not any humor or laughter in this. This was so serious. I said, what have I got myself into? Morning reports, and you get together, it was serious time. So I was kind of sensitized from then on to say, boy, this is a serious profession. And then the thing called death caught up with me, meaning a couple of patients that I thought I had really done great died. And I found no release. I found no way. There was no laughter involved. So finally, I worked through other avenues, music and meditation, and a wonderful wife counselor. But I found that there's got to be a release. And boy, I tell you, humor and laughter is a fabulous way to release. But you have to use it in the right way, which we can talk about.
Well, and I would reflect that it's, what do they call it? It's not, it's gallows humor. In the circle around the nursing station, the doctors and the nurses interact a lot. There is sometimes a lot of laughter in that space, and it's a release laughter. It isn't ever about the patient and putting anybody down. It's never putting anybody down. There's a lot of humor in that place.
I agree.
One of the funniest places to interact is at the hospice meetings, where we're caring for dying people, and I can tell you that it is a joy to interact with these people, and it is never a negative thing about patients. It's just people who are deadly serious about certain issues, but there is humor and there is joy in this group, and you have to have it or you couldn't go on.
Correct. Yep.
So a little bit about your training.
Well, I was trained as a cardiologist, but as I progressed further in my age and experience, I actually went back to being more of a preventive cardiologist and a general internist. In fact, I run a diabetes and lipid research center at St. Luke's Hospital. So I have really come back to my core training of internal medicine and use it a lot. And I'll tell you, humor in my research unit, some days I have 6 women that I work with. I'm the only male and there are 6 women, and they're pretty serious folks. They don't know what to do with me some days because I don't let them get serious anymore.
We need to have fun.
Yeah.
Life is too short for us not to enjoy ourselves.
Yeah.
Should we have you
Do you want me to
stand over here
do
and
the session? And
do
then-
a session?
Okay, sure.
Or would you like to do anything more different right now?
No, so let me just go through a few definitions. So we've talked a lot about humor and laughter, and they're actually not the same thing. Humor can make us laugh, but I'm sure many of us know that humor can also make us feel bad. And I know my husband would say that I don't laugh at any of his jokes and he doesn't laugh at any of mine. So there's clearly, personal things that make us laugh. Whereas laughter, actually, the actual act of laughter is physiologic. And so all laughter is beneficial, as long as somebody doesn't have a stroke that gives them a bad case of, uncontrollable laughter. And so what I actually have done is I actually went, so one of my credentials that he didn't present was I actually went and got certified as a laughter leader with the World Laughter Tour. And we can talk about that a little bit, about how that actually came to the United States. But the whole idea of laughter clubs and just laughter as being beneficial actually came out of India with Dr. Madan Kataria. And he is a family practitioner, and he was in India. This is in the 90s. And he started thinking about laughter and got a group of 5 people together, 5 of his friends, and told jokes. And they met every day, and he would tell jokes. Well, you can imagine what happened after about a week. Yeah, he ran out of jokes. So then he figured, well, can't we get the same benefit with just doing laughter? And he looked at the research, and he said, yeah, the same benefits are there whether you tell a joke or you don't tell a joke. So he actually started the whole notion of laughter clubs. And it started in India. They now have thousands of laughter clubs. They have a laughter day in India where hundreds of thousands of people pour into the streets, and all they do is walk up and down the street laughing. So you can imagine, you can probably Google this, I'm sure, where they do that. I would love to see, don't you think we need a little bit of that in Washington, D.C.? Yeah. I mean, can you imagine that, right? Walking up and down, let's pour everybody in, not to say, congressional, just stand there and laugh. I think it would be a very interesting experience in our country. So what I'm going to actually guide you through is actually a little bit of a laughter club. And so which is what I did for the Board of Governors, where I now have 2 new recruits into this. And so what I want you to do, what I'm going to need Rick to do is he's going to need to remove his coat and tie, because you can't really laugh seriously if you're feeling constrained. I'm happy to see that I don't have to tell any of you to relax, because you're all here in shorts and T-shirts, so that's great. What I do want to tell you, though, is what we actually are going to be doing is exercise. And so as a physician, I do have to warn you that if you have ever been told by your physician that you should not exercise, and I'm quite sure there is not a physician in this country that would tell somebody that, but if in fact you were told that, then I don't want you to laugh. Okay, I want you to sit there and not laugh. Okay, if you think that exercise is going to be bad for you, then you're going to need to tone it down. For those who might have some medical issue that might make laughing problematic for you, so if anybody's had any recent surgery, I'm going to need to really ask you to not laugh out loud very much, because we will be using all of our chest and abdominal muscles. If anybody has any bladder control issues, okay, now is the time to really practice those Kegels, okay, if you know what I mean. Because we will be doing things where we will be increasing that pressure, and there might be some things. One real issue is actually if somebody has asthma or reactive airways disease, actually doing therapeutic laughter can sometimes trigger asthma, so I hope you have an inhaler handy just in case. Okay, now, when we do laughter, laughter is actually universal, and I know we spoke about this before this session, but if you listen to laughter across the world, there is really no difference in how it sounds, whether you're in the United States, whether you're in Africa, whether you're in Asia. Okay, you might even say that there really isn't much difference if you listen to chimpanzees and other mammals of that sort, because they actually also have social laughter. And it's actually we asked, what's the animal research in laughter? And I really don't know, but there is some. So it is non-denominational, it is non-confrontational, it is non-political, it is not religious, it is not competitive. So one person doesn't laugh any better than anyone else. So we're just going to be here to have some fun together, okay? So in order to get prepared to exercise and to relax, I want you to all kind of just relax, kind of shake your, okay? Maybe you've all had stressful days today, the weekend's coming up, yay. All right, we're really happy. And I want you to just take some big, deep breaths and then let it out. Good, let's do one more. And out. Great. Okay, now that we've warmed up your breathing muscles, we need to warm up our laughing muscles, right? Because we just heard that we don't laugh more than 6 minutes a day, so we're probably out of practice. So by doing that, we're going to start with a little exercise, and it's called ho, ho, ha, ha, ha. Okay, so you're going to repeat after me. Ho, ho, ha, ha, ha.
Ho, ho, ha, ha, ha.
Ho, ho, ha, ha, ha. Excellent. Now we're going to add a little bit to that because, again, we want to get some of our calories burned off here because, again, weekend's coming up. We're going to eat a little bit more. We're probably going to have some chocolate cake eventually. So we want to burn as many calories as we can doing this. So we're going to add a little clapping to it, and it goes something like this. Ho, ho, ha, ha, ha. Let's all try that. Ho, ho,
ho, ha, ha, ha. Ho, ho, ha, ha, ha. Ho, ho, ha, ha, ha.
and then just throw your arms up in the air. Because it's just really fun. Okay, so what we're going to do is we're going to start off with some laughs. And we're going to start off with a greeting laugh. And I'm going to ask Rick to come over here and be my demo guy.
Look out with your wire.
Okay. And now, how many of you have been to Hawaii? Okay. How do you greet people in Hawaii? Aloha. Okay. Oh, you're not plugged in. Okay. You're de-plugged.
I was
Okay.
deplugged.
Oh my gosh.
Okay.
Can't have that.
All right.
So, what we're going to do is you're all going to stand up. I'm going to demo this, and we're going to greet each other in the Hawaiian way, and it's going to go something like this: Aloha.
Aloha.
Okay. So you're all going to stand up. I want you to greet as many people as possible with the aloha laugh. If you don't want to participate, that's okay again. Non-confrontational, non-denominational. Okay, but greet as many people as possible with the aloha.
Aloha.
Ah, it's good.
Okay, good. Now that I got you on your feet, no sitting down. Okay, so this is actually one of my favorite laughs, and I know these guys know it. And how many of you have ever been on a plane before? Everybody. Okay, so how many of you actually ever watch the airline safety talk? Oh my gosh, really? Okay, the first time, yes, and the 100th time it's like, oh my God, okay, just read your book. All right, well, this is the airline safety laugh. And it looks, I cannot get on a plane anymore. If I watch the airline safety talk, I just start laughing now because I do this laugh so much. So it's going to go something like this. Now remember, part of the thing about laughter clubs and laughter working together is watching everybody else. So I know I look silly, and I am really sure you're going to look silly too doing this, so you're going to watch each other when you do it. Okay, so let me demo it, and then on the count of 3, I'll have you guys do it. So it looks something like this. Now all of you are going to try that. I'll still be up here doing it with you, but remember, please try to watch each other when you do this. The airlines, and you can do it in whatever order you want. It really doesn't matter. On the count of 3, the airline safety laugh. 1, 2, 3. Okay, how many of you are already feeling your heart rate's going up? Okay, all right, you can sit down. Take a big deep breath. Remember, this is exercise. We want to remember to breathe so we don't get overstressed. Okay, so it is the Queen's Jubilee year, so I thought we would do a laugh in her honor, even though we've broken from, the UK a long time ago. And this is called the Royal Wave. Okay, so we're all going to laugh, and remember, you need to look at each other, and you're going to be waving in the royal wave. So it's going to go, okay, because we don't want to get too tired, right? Because you're doing this for hours at a time. So we're going to do the royal wave on the count of 3. 1, 2, 3.
oh, ha, ha, ha. Oh, oh, ha, ha, ha.
Okay, excellent. What I'm going to teach you now is actually called the lion's laugh, and this is actually a true yoga position. And actually, somebody was just doing that in my office the other day. They were kind of doing it with the whole stomach crunching thing, which you can do if you want to add a little extra. But it's a lion's laugh, and it's actually to kind of, it looks a little bit like the Maoris when they go to battle in New Zealand. But we're doing the happy lion, okay? So we're not doing the warmongering anything. And so it's a happy laugh, but it actually is an express and a release. And you're going to put your hands up like this. And then when you do the laugh, you're going to open your mouth real wide. You're going to stick out your tongue. If you want to do it with the crunch, that's fine. That's a little more yoga. And you go like this. Okay. Yes, it looks funny. Okay.
It looks funny?
On the count of 3. 1, 2, 3. Okay, I have a few more minutes, so we'll have a few more laughs. Now, do you guys want a little more energetic one? Yeah. All right. Oh, yeah. I like that. All right. Okay. How many of you mow your own lawn? Oh, wow. Okay. With an automatic one you sit on, or with one you actually have to push? Push. Yeah. Okay. Yeah. We don't mow lawns over in this town. Okay. All right. So this is actually called the lawnmower laugh. And I'll demonstrate it first, and then I'll have you do it. And again, you're going to move around the room when you do this. So my lawnmower is not very good, and it's a little old, so it's going to take a while to get that started. So it's going to go like this. And you're going to mow your lawn as far as you want to around the room, okay? Maybe your lawnmower works better than mine, but so you can start off right away if you want to. So on the count of 3, the lawnmower laugh. 1, 2, 3. Okay, take a big deep breath. How many people's heart rates are going up now? Yeah. So how many of you feel more energized now than when you came into the room? How many of you want to go home and go to bed now because you just exercised and it's time to go eat and go to bed? Okay, great. Okay, let's do. I have to introduce the one that Alan and Rick already demonstrated. And actually, this laugh I created, and it came about because one of the public health people that I know in Seattle never shakes hands with anybody. And that kind of started when we were having the H1N1 influenza outbreak. And so she would always greet people with her elbow. And so I'm like, oh my God, that's a perfect laugh. And so we're all going to do the H1N1 anti-influenza laugh. And they've already demonstrated, but it goes like this. And again, then you walk around the room and you try to introduce yourself. And really, if it is flu season, you can actually use this in real practice, with or without the laugh. Okay, if you don't want to shake people's hands because you might not have your Purell handy right then and there. So on the count of 3, the H1N1 anti-influenza laugh. 1, 2, 3. Okay. All right, let's sit down. We'll do one sitting, and then we'll get you moving again. 5 minutes. Okay. So the next one we're going to do, and this is one that you can kind of do in pairs. It's called Oh My Achy Back, or Oh My Achy Knee, or Oh My Achy Head, or whatever. So many of you may know that if you actually do deep breathing, and again, yoga and yoga breathing exercises are about this. If you actually have something that hurts, if you actually think about breathing deeply into that area that hurts, it actually makes the pain better. There's also a great study that actually looks at increasing your pain tolerance with laughter. And so that's what this laugh is about, is if something hurts, laugh into it. Okay, to try to reduce the pain, to try to have more pain tolerance, perhaps reduce the use of any medication if any of you are on any. So this is called Oh My Achy Back. It doesn't matter if it's your back or your knee, whatever. And remember, it's not competitive. So nobody has more pain than anybody else or more achiness than anybody else. And it looks a little bit like this. So it's like, okay, so whatever hurts, you're going to just laugh into it. So, and you want to do this in pairs because you kind of, even though it's not competitive, it's still better that you kind of share this with someone else. So on the count of 3, oh my achy back, head, knee, shoulder, whatever. 1, 2, 3. Okay, I'm going to end with this one because I think I'm almost out of time, so I'm going to actually have you stand up again. Now, how many of you know the hokey pokey? Okay, the hokey pokey, I know, okay, I'm dating myself. Yeah, the young people probably have never heard of this. All of you in the front row I know have. Okay, so we're going to do the hokey pokey laugh, and it is literally hokey pokey laugh, only we don't sing it, we're going to laugh it. So we're going to start, we're going to just do kind of just a couple of them, and then we'll stop. So on the count of 3, I'm going to have us do it all together. Okay, so it's going to be ha 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 ha. Okay, you know how the song goes, right?
Yeah.
Okay, so we're going to do that all together. Again, face each other or get in a kind of a circle so that we can do this all together. We'll look better. On the count of 3, 1, 2, 3. Left hand. Okay, whole body. Right, good job. Okay, breathe. Okay, and again. How are you all feeling? Energized? Good? Yeah. All right, you're going to go home and do this now? You're going to go home and sleep, I know, I can tell that. Okay, I got 1.5 minutes left. Okay, we're going to do questions, I think, for now. I just want to make sure, remember, we just exercised. You probably easily burnt maybe about 40 calories, okay? So the more you laugh, the more you burn. It's kind of like running. So we probably did exercise almost as much as a runner for about the same amount of time. So really proud of yourselves for that. Yay. Okay. So now you can go out and do this anytime, any day in the car. Okay, I do this in the car after I've had a really stressful day at work. And when I'm really, I go, you know, I need to laugh. And I'll sit, you know, and I'll be sitting there at the stop sign and I'll just go, and then I look on this other side of me at the cars. It's like, hey, I'm having fun. So it's something that you can use all the time. So what we're going to do now is just finish with some laugh-formations, and then we're going to go to, I guess, Q&A. And the laugh-formations are really just about, from World Laughter Tour, just remembering how much we did here today and that we were really happy that we could do that. So it's not, again, it's not religious, so we're not doing anything. So what you're going to do is you're going to stand up and you're going to just put your hands like this, and after each laugh-formation I say, you're just going to raise your hands in the air and go, Yahoo! Okay, so stand up. Okay. I'm so happy that we were able to laugh today here in Brookings, South Dakota.
Yeah!
I can be happier today than yesterday.
Yahoo!
And I'm going to laugh more today and tomorrow than yesterday.
Yahoo!
All right. Good job.
Well, that was wonderful. And my
It's a
laughter-
workout.
It's a workout.
Yeah.
I feel better.
I do too.
So after we had that session, we walked out of the room, and all these other guys were, and we're all laughing and animated, and that room was full of doctors just enjoying themselves, coming out into the audience, into this room, the other room of other people who had been sitting on a lecture on how to do better leadership.
Or coding and billing.
Coding and billing. It might have been a coding and billing lecture. That's a. So, and they went, we missed out. They did. You could just feel it. And then, of course, Alan and I went,
And they said, what?
what is this?
What are you doing? Aren't you serious doctors?
Yes, that's it.
And this is serious medicine, and that's why I think, again, it's evidence-based medicine. And there's lots of evidence that this is beneficial.
Let's talk about that just a little bit,
Yeah.
Carrie. What evidence, I mean, what is the benefit? I mean, I know that it's a good idea to laugh, but some people really don't laugh much.
No.
And, I mean, how can you bring them to that? That would be one thing. I mean, you need go to movies or read funny books, or what do you suggest to your patients?
Most of the literature that actually is about laughter actually used humor. So they actually used video clips, and a lot of the studies that were done, and you have to recognize none of these were in New England Journal of Medicine. So they weren't great studies, but they're really interesting studies. And what they actually used was humor, and they had people watching either clips of funny things, humor, or serious things. So they did one study where they actually had them watch war movies. And actually studied, and this was one of the cardiology ones where they actually studied blood pressure and what happens with the arterial stiffness of your body. And those that watched humor and laughed actually had better arterial mobility, relaxation.
Yeah.
And those that actually watched the horror movie actually stiffened. And so it's hard sometimes when things are very difficult for us to actually remember to laugh as a mechanism that's healthy for us. And so my motto is fake it till you make it. I get asked a lot, well, does it really mean anything if you're really not feeling it? And I'm like, the answer is yes. The studies show that whether you mean it or you don't mean it, the actual act of smiling or laughter actually has the same health benefits to your body, because your brain doesn't actually know the difference. Now, obviously, if you can do it and be mirthful and happy about it, that's better. And it doesn't mean mean laughter. So again, the joke telling that's actually harmful or detrimental is not what we're talking about here. We're talking about mirthful laughter and the actual activity of laughter. That's happy laughter. So.
And I actually would really invite questions from the audience. If you have a thought in your mind, I'd love to have you raise your hand. If you have a comment or a thought or a question anywhere along the line. Alan, you're a cardiologist, and you care for a lot of people who are uptight, the type 1 and type 2.
Sure.
What do you know about the type 1, type 2 individual thing, that whole story?
Well, that's a long time ago. That's the Friedman and I already forgot the other guy's name. But that really isn't used that much anymore.
It isn't, is it?
That
The
really
type 1
isn't.
and type 2.
Type 1 and type, see, I think it's broader than that. I think type 1 and type 2 they would analyze some individuals, kind of like what Carrie said. These are uptight individuals, very anxious, and they talk very fast, and they don't have time to think too much because they just talk too much. Versus individuals who are obviously more relaxed and more, when things happen, their blood pressure does not go up. So I frankly don't use that anymore.
I think there was some data that said that the type 1s lived as long as the type 2s.
Yeah, exactly.
It's just that they had small heart attacks sooner or something like that.
Yeah.
Well, the more recent study that came out actually was a study looking from the Women's Health Initiative,
Yes.
which you might be familiar with.
Yeah.
What that study actually looked at was optimism versus cynical hostility. And they actually did this by a series of questionnaires, and people who had more optimistic outlooks on life actually did better in terms of lower rates of heart attacks, lower rates of all cardiac
Right.
heart disease, and lower mortality overall. And then cynical hostility, so people who are always kind of angry and,
Mad.
And it
Yeah.
didn't really address how do you become, so if you're just personality-wise more optimistic than not, how can you increase your way to being more optimistic? And I think laughter is one of those ways to do it.
And I
Makes you
think,
feel more
and I
optimistic.
think for most physicians, I think we've got a physician in the audience, that with a little training, we can recognize folks pretty quickly. I think within 5 minutes, I bet you would agree that you can recognize somebody who is really uptight. And your approach when you get to a diagnosis and now talking about treatment should involve relaxation techniques. And I think obviously laughter, but I can say playing or listening to music or going to an art exhibit or going to a relaxing movie, not a I don't go to stressful movies. I go to relaxing movies.
I go to funny movies.
Yeah. So there are other ways that you identify those individuals that you should include that in your discussion of therapy. Yeah.
I have thought about how do you bring happiness. There was an article in the Mayo Clinic about burnout,
Right.
about burned out physicians.
I read that. Yeah.
And they could identify the physicians who would burn out. And the ones who didn't were the ones who seemed to have this optimistic, positive attitude. And I can't remember ones who have better memory. I think that was the other one.
Welcome to the club.
Yeah. So I do think that a faith of some kind is an important thing. To be able to say you're not the all-powerful, that you give it up to some higher source is an important issue for health, as well as an ability to let go. And some of us carry everything everywhere, and some of us can let go of it. That comes to the Transcendental Meditation group. Talk about that.
Well, I happen to have a wife who has been doing TM for 20 years. And it so happens about 5 or 6 years ago, I wrote a review article on Transcendental Meditation and hypertension.
Oh.
And guess what? It works, but it works about this much, meaning studies, they're not great either, but the studies that I reviewed showed with about 4 to 5 at the max. So if your systolic blood pressure, so if your systolic blood pressure is 145, you may be able to lower it to 140. If your diastolic blood pressure, normal being less than 90, so if it's 95, we may be able to lower 3 to 5 millimeters down to 90. But if you expect it to go from 180 over 110 to normal, probably not.
It won't. You need the drugs.
Yeah.
Well, Herbert Benson did that book, I remember, and one of the things, I read that book backwards and forwards, and I gave out copies of it to my patients early on. And he was studying the Transcendental Meditators, and then he studied what was it in every religion that was consistent with the others that worked with the Transcendental Meditators, and he said that it was that being able to let go of responsibility and give up to someone else, that you're not responsible for a period of time and you don't go to sleep, you just let go. Now, we have a transcendental, am I talking the right thing? And he took meditation from all different religions.
Right.
And put it together in this little deal. And now he's changed, instead of 20 minutes, it's mini meditation. You explain it better.
And I think the key is you don't have to spend how many hundreds of dollars you've spent to go get your formal training. I think it's a technique we could teach it here in 20 minutes. And that is to just sit back, relax, close your eyes, and think about say the moon or the sky or on the wall, something that is so abstract that you can't respond to it, and just let your mind relax.
We have a question from an audience member.
Yeah.
Okay.
So what is your question?
I've heard that laughter enhances creativity. Can you speak to that?
Enhances creativity.
Any comments?
Carrie?
I haven't read any specific studies on laughter, but what it does do, I think it relaxes your mind enough to allow you to do other things. And, you know, so I would say that most physicians probably are left brain more with all of their analytical and stuff like that. And being able to relax and the mechanism of laughter, what parts of the brain that actually are affected, might lend itself to being more creative. I mean, it kind of goes along with what Alan was saying is laughter, breathing, meditation, creativity, dancing, music. These are all
Are they more
arts
right
and
brain?
sciences. They're a little bit more.
Yeah.
And I think they actually balance us when we're too stressed and everything like that. So I don't have a specific thing to quote for you for that, but
Possibly, Joni, there is a neurologist named Oliver Sacks who's written a book called Musicophilia. And by the way, there's a bunch of functional MRI data that's going to come down the pike on this area. But he showed that individuals who are having trouble recovering from a stroke or a traumatic brain injury may not be able to talk. But if you stimulate the creative side, meaning the right brain, that they can play, sing, they can go to the piano and play. If they used to play the piano, they can go and play the piano. They can play the flute. They can strum the... And yet you take them away from the music stimulus and go back to the left brain and try to talk. They can't talk. If you so crossing over the corpus callosum between the two sides, yes, I think. I don't think we have hard scientific data, but Oliver Sacks would say it works.
Well, I have a patient, a good friend who was a music teacher, a high school music teacher, and he had a big stroke, a blood vessel broke in his brain, and he lost his right side, his ability to speak. A lot of his, that came back, but he really lost a significant amount of his capacity to function. He couldn't teach anymore. But does he play the saxophone? And at church, he'll perform for our church periodically, and he rolls in on a wheelchair, and then covers one eye because he can't make them focus, and then he plays this most beautiful music, which has included jazz and all sorts of things, and we eat it up.
Well, what we're saying here, I bet you the research will come. We're saying music works on the right brain, creativity works on the right brain. I bet you laughter works on the right brain.
Where does that come? Do we know where laughter comes in the brain? I mean, do we know?
there's a lot of different places. It definitely affects the amygdala and the hippocampus.
Right.
Which is for the audience, that means parts of the brain.
For the audience, it means parts of the brain.
Older parts of the brain, very
Older.
old parts that
But-
were there for...
Called the limbic system.
But if you think about it,
Yeah.
the research, and I brought the book called Laughter by Robert Provine. I'm not advocating for the book because it's a little dry. But he does talk about apes and mammals that actually do laughter. And so, yes, when you talk about these being the older parts of the brain, that makes sense because we've developed as mammals that way, and so stimulating that part of the brain is effective.
Hey, we've got another question.
Yes, I'm a scientist, and our group is sort of characterized as, serious, non-fun, hardworking, and that sort of thing. If I introduce laughter into our group someplace, should I be concerned about, say, lack of professionalism if I did such?
What is your comment?
So my comments on that, I absolutely agree with you. I think above all, I'm a professional. I do not walk up and down my hallways at work just laughing for no reason. I do use it in my practice with my patients, and I choose those patients very carefully, and I'm extremely professional about it. If I feel that laughter can benefit somebody health-wise, then I will use it. I will teach them an exercise, or I will talk to them about using humor and laughing as part of their therapy with other things that I do. Can you have laughter and humor and those things at work and still be professional? Yes, I think you can. And these are actually the laughter clubs and these laughter exercises that are actually being brought into all kinds of places. Police stations, they're being used in military, they're being used on cancer wards, children's hospitals. There's a organization called Clowns Without Borders that actually go into war-torn areas and use laughter as a way of de-stressing. So I think if you're going to laugh, you're right. First of all, it should not be humor, which can be misconstrued or misinterpreted. But laughter itself has a lot of benefits, and there are places that will have like laughter once a week. They'll do a little laughter mini club like we did, and then they do that once a week as a group, as a professional. It's a great icebreaker and great for working together as teams. So I think it can be incorporated, and if you're interested, I would recommend reading more about it and learning more about it, and learning how to be a laughter leader.
Which laughter leader? So if you were interested in going into this further or reading something, what would be a really good, accessible, readable book?
Or website.
Or website. So probably the most accessible website would be World Laughter Tour. And this was designed by Steve Wilson, who is actually a psychologist. And he studied with Madan Kataria and kind of brought the whole laughter club, laughter thing back to the States and sort of Americanized it by credentialing people as laughter leaders. But there's a lot of information on that website, a lot of articles, a lot of the research that I quoted will be posted on that.
Can I come back and answer that too? Because I think that's a key issue. I have not felt comfortable personally laughing with a patient unless I really know that patient. And there's this flip side of that is, if I really know that patient as a personal friend, I probably shouldn't be their doctor. So, that is an issue. But in a group setting, and to talk either to any group of people, physicians need to heal themselves. And we need to find a mechanism for physicians to realize they need this kind of therapy. And a lot of them are...
other health professionals.
Yeah.
Well, and other health professionals.
And all, yeah. Whether it's nurse practitioners or nurses or PAs or pharmacists or social workers. I mean, the whole field, I'm not sure, has recognized how much they need this approach.
I think we take ourselves too seriously too often.
Yeah.
There's another question from an audience member.
My father has health issues such as heart disease and diabetes-related kind of issues, and he has sometimes congestive or breathing issues. And could something like the laughter exercise be used in a milder form where it would benefit him because he isn't always able to do regular exercises?
So I would say I have used this.
Repeat the question.
Oh, I'm sorry. So the question was, could somebody with serious heart disease like congestive heart failure possibly use this? There actually are some studies that actually shows that you might actually increase your energy expenditure and possibly improve your ejection fraction a little bit with laughter. Again, none of these studies are great. These are not randomized, controlled, double-blind, placebo trials. But I think, again, first of all, if his physician doesn't know about it, it would be hard to actually guide the person. But there may be benefits to laughing. I just had a patient in my practice who actually has congestive heart failure. She's having kidney disease and kidney failure and is very upset about it. And I actually worked with her to try to get her to start doing some laughter. I haven't seen the results of that yet. So I don't know if she'll benefit from it or not, but it is possible to do that, and you can probably talk to the cardiologist.
Well, theoretically, it makes sense because laughter, as we just did, is a relaxing effect, and it relaxes the blood vessels. So the heart trying to eject blood out into the aorta, if you lower the resistance and relax this resistance out here, it ejects better.
Right. Eases the heart, would relieve heart failure.
Yeah.
Well, the thing that strikes me, and I love having fun. My mother, who, God bless her soul, who just passed away a couple of weeks ago, was the most fun person that I can think of. But there's times to be serious.
Yeah. Of course.
And maybe they're too much of that. I don't know. I think about it when I care for people who are severely depressed, or there's been suicide, or there is such sadness and loss in a death of a young person. Right. And you never would want to put those people in a spot, so you need to be in their realm. But somehow when when we walk out of that room, we've got to be able to survive too. And I think that's a huge key. There are many reasons for unhappiness in this world. Just turn on the news and you can hear all about it. There's disharmony, killing, and wars driven by hatred between families, tribes, gangs, religions, races, nations, and even political parties. And think how the economy is not so good, with poverty seemingly always more prevalent. In every country, there are people who go to bed hungry. Natural disasters abound with fires and flooding and hurricanes. And isn't it true that each of us are connected with a friend or a family member who's dealing with divorce or alcohol or abuse? All this while our own aging process marches on and death appears everywhere around us. At times like these, wouldn't it be nice to have a piece of rhubarb pie? Or as Garrison Keeler on the Prairie Home Companion also advises, maybe we could use a little more ketchup. This is not to say that we shouldn't fight against oppression and injustice, but the prayer says it all. God, grant me the serenity to accept the things I cannot change, courage to change the things I can, and the wisdom to know the difference. The insight between the lines advises we should learn to savor the good things in life. Well, carry that thought a little further. To combat all that unhappiness, we need to have a sense of humor. Indeed, laughter has to be one of the best ways to cope with the troubles all of us have to face. Think how a good laugh hangs with you long afterwards. It seems to go to a part of our soul that says maybe things aren't so bad. Laughter gives us the courage to find a new source of hope. And most powerfully, laughter is one part of the human psyche that dissipates hate and disharmony and brings a crowd together with a shared common human experience. During all that after high school training, when I was struggling to turn from a kid into an adult, my dear old dad wrote me a snail mail letter of support every week. Each note was signed off, "Don't take yourself too seriously, son." I promise to try harder to do that, Dad, and maybe have myself a piece of rhubarb pie. Before we end, any comments or responses or thoughts that you would have to kind of conclude? You've got about 30 seconds.
No, first of all, I want to thank you all for coming and for participating. One other thing is laughter is one thing. One other thing we talk about is, as Rick was alluding to, is good-hearted living. And so just to leave you with a thought is every day you might think about doing something that's pleasant and helpful. And you might think of Mondays as being a day that you give out compliments. Tuesday's a day for flexibility. So maybe things don't go so good, like flying home from a conference. But remembering that we can all be flexible. Wednesdays are for gratitude, waking up every day being grateful for something we have, and being aware and keep that as preciousness. Thursday being kind to other people. Friday for forgiveness. As it's been said, while I'm being angry, the other guy's out dancing. So does it really help for us to keep all that anger and hatred inside and forgive somebody? And then the weekends, of course, are for chocolate or rhubarb pie, depending on your preference.
Oh, I would say a nice glass of Pinot Grigio.
Oh, there you go.
There you go. Alan?
Well, and seriously, I think at the end of the day, I do look forward. We want to talk about the health benefits. It's always been argued about alcohol. And there's no question that 2 or more drinks, certainly 3 to 5 drinks a day, is dangerous to your health. But from a cardiology standpoint, it's a relaxant. It stimulates the good cholesterol, the HDL, and I feel better. I'm more relaxed. So I think, I don't want to create alcoholism if there's a trend in any of you, but I look forward to it, and it's very relaxing to me. Yeah.
Well, and I want to thank you both very much for coming to South Dakota from Seattle, Washington on your own dime, right, and from Kansas City, Missouri, Kansas
driving up.
And joining us to share with this public service. And I thank you for listening, and may you all enjoy a piece of bebop or rhubarb pie. Stay healthy out there, people.
Funding for On Call is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
LARSON Manufacturing is proud to support On Call, starting its 11th year of opening doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, Regional Health, the Brookings Health System, Dr. Mark Bubak with Dakota Allergy and Asthma, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.